Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing you another really awesome guest today involved in creating a better and safer tomorrow for all of us. Today, we have the honor of being joined by Major General Dr. Paul Friedrichs, who is inaugural director of the Office of Pandemic Preparedness and Response Policy at the White House, a permanent executive office aimed at leading, coordinating, and implementing actions to prepare for and respond to pathogens that could lead to a pandemic or significant health-related disruption in the United States. And he's principal advisor on pandemic preparedness and response, appointed by President Biden. Dr. Friedrichs was previously Joint Staff Surgeon at the Pentagon. There he provided medical advice to the Chairman of the Joint Chiefs of Staff, the Joint Staff, and the Combatant Commanders, coordinating all issues related to health services, including operational medicine, force health protection, and readiness among combatant commands, the Office of the Secretary of Defense, and the services. Dr. Friedrichs also led the development and publication of the initial joint medical estimate and served as medical advisor to the Department of Defense COVID-19 Task Force. Dr. Friedrichs received his commission through the Reserve Officer Training Corps and his medical degree from the Uniformed Services University. He has commanded at the squadron and group level, served as an assistant professor of surgery, and led joint and interagency teams, which earned numerous awards, including as Best Air Force Hospital. As chair of the Military Health Systems Joint Task Force on High Reliability Organizations, he oversaw developing a roadmap to continuously improve military health care. And as the command surgeon for Pacific Air Force's U.S. Transportation Command and Air Combat Command, the general and his teams identified various gaps, developed mitigation plans, and enhanced readiness for future conflicts and contingencies. It's going to be a very exciting show today. Welcome, Dr. Paul Friedrichs, inaugural director of the Office of Pandemic Preparedness and Response Policy, to our show.
Well, thank you very much. It is exciting to be here and to join you today, and looking forward to sharing a little bit about what the team and I are working on as we look at all the interesting things happening around the world in the biological space.
Absolutely. I'm really looking forward to this discussion. But, before we get into, everything you're doing now and talking about pandemics and preparedness and mass casualty events a bit, Paul, I'd love to hear just a little bit more about you and what was happening beforehand, because I know that, prior to this, you started your career off in urology. We're doing some pretty comprehensive work in the area of prostate cancer genomics. I think back when the Human Genome Project was just happening. Give us a little bit of the background story before we get to the meat of what's going on today at OPPR.
Well, thanks. I appreciate that. And yeah, I actually took a year off from my residency to go and train as a molecular biologist. And at the very last minute, that training got canceled and they sent me out as a general practice physician, which turned out to be a great thing. I got to work with our special operations community for a year and then came back to my residency, but have had a longstanding interest in genomics and in understanding genetic contributions to developing malignancies. And that's actually surprisingly relevant to the work that we're doing in this job today, now 30 some years later. But in between there, have had some remarkable opportunities thanks to the military to serve everywhere from above the Arctic Circle, taking care of Native Alaskans and villages up along the Bering Straits, down to our research facilities in Antarctica, been in combat, been a research director, all sorts of incredible opportunities. And I think, all of those have helped prepare me for this role and the opportunity to try and integrate and figure out how to do things more innovatively as we look at evolving biological threats. So very grateful for a remarkable 37 years in uniform, and now for this opportunity to try and work with partners at a different level.
Absolutely. And during your time at the office of the Joint Staff Surgeon, as well as in collaboration with the Uniformed Service University of Health Sciences, you did a bit of publishing on this theme of mass casualty incidents, sort of defined as these events that overwhelm the healthcare system. And you published both on protocols for medical response, as well as the development of therapeutic countermeasures. I was very intrigued by one of the papers you wrote specifically on dried plasma, because that kind of fit nicely in a discussion I had with Ian Watson over at the Pentagon a couple of months ago on, us thinking about sort of what are the interventions that we need to broadly treat patients. And not, we can look at an Ebola countermeasure or VX, but thinking more broadly about what we're developing for these incidents. Talk a little bit about your time in this area. I think it's very important.
Well, thanks. And I'm grateful that you took the time to track some of that stuff down, because that's a project that's near and dear to my heart. Looking back at history, in World War II, the United States was the blood bank for the Allied forces. And we actually developed the whole process for freeze-dried plasma and plasma derivatives. And we led the world in research on that area for many years. And then as we moved away from combat settings, we decided that we did not need to maintain that. And so we're in an interesting place now where we're realizing, again, thanks to the very painfully learned lessons in Ukraine and in Israel, that we do need to have better access to a diversity of blood products. And so there's a number of researchers and partners here in the United States and in the UK and elsewhere with whom we're working to make sure that we have those capabilities ready to go, and that we are also looking at new and innovative capabilities. Some of your listeners may be familiar with DARPA, the research, kind of cutting edge research arm of DoD, and they have a project underway right now, which we strongly supported when I was on the Joint Staff, looking at new and innovative blood substitutes that can be used, and ideally looking for ones that don't require refrigeration or some of the other special handling measures that current products use. And so that's an area that I think we were the leaders around the world for many years, and we are now doing some really innovative research. And I hope that that continues, and we do come up with better solutions for the 21st century, because it does seem likely that we'll need those. And the great advantage of some of those is if we can find temperature stable products that we can use, it also allows us to get them out to remote areas like rural communities that may not have blood banks, and other areas that historically have been less well served. And then on the mass casualty front, we've spent a lot of time over the last 20 years, going back to my military experience, fighting in low intensity conflicts in which we saw, unfortunately, thousands of casualties, but we did not see the level of casualties that we saw in the Korean War or in World War II or in World War I. And so part of the planning that many of us worked on was, if we were in a conflict like that, what would that look like? Mm-hmm. What are the sorts of capabilities that we need to have across the United States? Throughout the Cold War, we had some really detailed plans that looked at how we made sure that we were ready for a large-scale conflict. And so we dusted those off, and then we looked also at what 21st century conflicts might look like and what casualty mixes might be, and what we would need to have both on the military and the civilian side to be prepared. And I think that's a big point that I try to mention in almost every talk that I give. To do healthcare right is always a partnership, whether it's in the operating room, it's the partnership with the surgeon and the OR tech and the anesthesiologist and the scrub nurse and the people who turn over the room, or it's in a conflict where it's a partnership between multiple countries. It is all about a team sport, and how do we plan for that and have those connections in place before we need them, not trying to develop them in an exigent circumstance.
Absolutely. Well, I was wondering, it was very interesting as we get, and we'll get to OPPR in a minute, but, obviously while the world was familiar with, what happened in the last couple of years and our Operation Warp Speed, you were also involved in, the end of 2021 in something known as Operation Allies Welcome, which involved an extremely rapid high coverage mass measles vaccination campaign, led by you at the Department of Defense. I was wondering if you could say a couple words about this, because obviously it's odd that we're speaking about in the United States about measles in 2024. Unfortunately, we are. But I was wondering if you could say a few words about this, because aside from obviously vaccinating a large group of people, you did it quickly. And I think this is another very important piece when it comes to dealing with these events, whether they're measles or something unknown, that we have to, prepare for.
So yeah, that was another example of a great partnership. That was international colleagues, the Centers for Disease Control and Prevention, Immigration and Customs and Border Patrol, and a whole host of people working with the Afghan displaced population that came into this country. And one of the things that we were very committed to was making sure that we protected these folks from Afghanistan, but also that we were protecting the American public. And so it was a very broad-based effort with some strong collaboration across a number of departments and agencies to make sure that we safely and effectively identified those who had not been vaccinated, and then offered them the vaccination and followed them up and administered it in a way that we could keep track of who was and who was not vaccinated. And, I appreciate the way you characterized it, because I think it is a great example of what we are able to do when we collaborate across departments and agencies. And I'll say it's also a great example of the importance of vaccination. We're watching the recurrence of measles around the world right now. We saw the outbreak in a variety of countries over the last few years, including back in 2019 when we had a large number of cases here. And we were very committed to minimizing the risk of that happening and leveraging vaccines, which we know are safe and effective to do so. So it was both a vote of confidence in vaccines as a protective measure, and also a demonstration of how, when we work together, we can get a lot done very quickly to protect individuals and the broader community from a preventable illness.
Excellent. So last year, your phone rings. It's the President of the United States, and he says, Paul, I need you at the White House by August 7th. We have this new office we're standing up, Office of Pandemic Preparedness and Response Policy. You're going to be leading it. Talk about what happened then, and please introduce us to OPPR, a little bit about where you are, your staff, and a little bit of what's been going on the last several months since August 7th.
Well, thanks. And I'll say it was even a little bit more dramatic than that, because what some folks know is that my wife is an ex-Army physician. She and I met in our residencies, and she has been following me around professionally for nearly 30 years now. And I had promised her when I retired from the military that her career would take the lead and we would do what she wanted to do professionally for a change. And then I got that phone call, and and I very candidly had to say, I really need to talk to my real commander-in-chief before I can commit to anything. So, no joke, I called my wife and said, here's what I'm being asked to do. And she, to her credit, said, this is an important opportunity to try and help at a different level. So after I retired from the military, I took off both Saturday and Sunday to get a little breather, and then started the following Monday. And it's been a remarkable journey. This is the fourth time that I've had the opportunity to stand up a new team. And certainly doing it here at the White House is an incredible opportunity. Get to work with many of the people that you see on TV and read about. And as we built the team, so grateful for the people who have agreed to join OPPR and help us bring together some tremendous expertise in therapeutics and diagnostics and in other areas. Our real mission is defined by Congress, and that's a little unusual in that as Congress looked at the lessons observed, if not learned, from the last 4 years. One of the things that both Democrats and Republicans identified was that there was an opportunity and a value in having an integrating function at the White House to pull together across departments and agencies all of the amazing work that the federal government does and figure out how to do it more effectively. And that's really the charge that Congress put into law when they stood this office up, was to be that integrator or that facilitator, not to tell people what to do, but to make sure that everybody knows that the Department of Defense is doing this, the Department of Health and Human Services is doing that, understanding roles and responsibilities, and then synchronizing efforts so that we're working together, not in parallel, working in synchrony, not in stovepipes. And if that sounds like maybe that's a little bit of a bumper sticker, it is. It's, that's what we spend a lot of our time working on, is helping to expose what different departments and agencies are doing on a particular area so that they can collaborate more effectively and we can get farther faster with the resources that the taxpayers ultimately provide to us. Some of the big things that we've worked on, you may remember the shortage of Beyfortus or nirsevimab, which is the immunization for infants for respiratory syncytial virus.
Yep.
Last year was the first time ever that we had safe and effective vaccines, not only for influenza, but also for COVID, and then for respiratory syncytial virus, which was really exciting. But then we quickly discovered that the demand among parents for nirsevimab was greater than the supply. And what we wound up doing was using our convening authority here at the White House to bring together all the stakeholders to help understand the constraints and figure out solutions to them. And ultimately, we were able to increase the available supply in the United States by about 40%, which wasn't 100%, but it was a substantial increase over what was originally available. And now we're leveraging those same relationships to make sure that we're even better prepared for this coming fall and winter respiratory season. Again, working with industry partners who ultimately are the ones producing this immunization, and with stakeholders across the country to make sure that we're ready to roll it out and inform parents and clinicians about what will be available. And I think that's emblematic of the value of an office like this. It's great to be able to say, this is the White House calling, and we'd like to invite you to a discussion on how do we help more children. There's not a lot of people who will say no to that. And we try to be very thoughtful about doing that in a way which is always focused on what's best for the American public and bringing in all the stakeholders so that we can get to a shared set of facts about the problem we're trying to solve, and then how we're going to tackle it as a team, rather than having everybody sort of independently working on it. Mm-hmm. So that's a great example of something that we've been working on, but happy to dive into other areas if that would be of interest.
Yeah, absolutely. And I this sort of segues nicely to my next question, because, one of the main parts of the OPPR mission on the website, it mentions drive and coordinate federal science and technology efforts related to pandemic preparedness. Before you had mentioned, when we were talking about the dried plasma, you mentioned DARPA, and we've been able to profile different guests from that amazing organization, as well as groups like DITRA, USANCA recently, even USDA and their new agro facility there. Talk a little bit about how, what it's, what's involved in sort of bringing together, because we have these great ecosystems of people doing biopreparedness work right now all across the military, other parts of our government. Say a few words about, what it really means to drive and coordinate this type of science and technology at scale.
Well, I'll say that, just my personal preference is I prefer to do less driving and more coordinating and facilitating, because at the end of the day, you're exactly right. There's a lot of remarkable people doing incredible work, whether it's at the National Institutes for Health or the Centers for Disease Control or the federally funded research programs that are occurring at academic centers all over the United States. And so it's not that we're going to come up with a new way to do things or that we're going to drive people to do something that they weren't doing already. But we are spending a lot of time trying to make sure that there's a shared awareness of who's doing what. You know, in the biological space, for folks who have looked at the National Biodefense Strategy, we lay out three broad areas of concern. One are the naturally occurring pathogens. You know, COVID is a great example of that, or Ebola, or Marburg, or Zika, or other things that occur naturally. Then there are the accidental biological risks, and then there are, you know, the reality that no matter how much we hate to admit it, there are always bad people in the world who will try to use technology in nefarious ways. And so a big part of what we do is trying to bring together folks working on all of those threats and share what each of them are working on so that we make sure that we're not duplicating efforts, but instead are building a complementary portfolio of research and development investments. There's a lot of work still to be done in that space because there are so many things happening. It was exciting to get in this job and realize that it's not just what the Department of Health and Human Services is doing. It's HHS plus the Department of Defense investments, plus the Department of Energy investments, Department of Homeland Security. The Veterans Affairs has a remarkable research portfolio, and I could go on and on. And so what we have tried to do is bring together all of these remarkable research leaders and figure out how we can build more complementary portfolios so that we get the best bang for the buck as we look at where to spend the next taxpayer's dollar, and also what the evolving threats are. You know, a great example is this avian flu outbreak right now. We've been working on avian flu preparedness for years. That's been a recognized area of concern, and thankfully we had some vaccine candidates in the strategic stockpile and a lot of work that we've been able to leverage so that we're better prepared. And you know, we'd like to think that we're doing that for other pathogens going forward, since we don't know what next year or 5 years from now will bring.
Absolutely. One of the groups that I've had the chance to profile on the show is known as the Bipartisan Commission on Biodefense, and had the honor to host the late Senator Joe Lieberman, Donna Shalala, former FDA head Peggy Hamburg. You know, all about this concept that this is one area, well, like a lot of unmet medical needs that requires moonshot thinking and fortunately moonshot dollars behind it. You know, you talk about those investments, you talk about the fact that you're the one that has to go up and liaise with Congress about these topics. What do you want to see sort of on the horizon as the United States moonshot in this area? I mean, what do you obviously it's not infinity dollars, but there is a number that we should probably be putting behind this so that, God forbid, COVID 2, 3, and 4 that are coming are dealt with efficiently this time around.
Yeah, so that's an incredible question, incredibly important question. I chuckle sometimes because I've had multiple people tell me, well, the big lesson learned from COVID is we'll just do Operation Warp Speed. We'll find the vaccine vending machine, put $10 billion in, and in a few months, vaccines will come out. And for many of your listeners, and certainly for you, you know that that's actually not what happened with Operation Warp Speed, that there was a tremendous amount of pre-work that had happened, 20 years of research on the SARS-CoV coronavirus, many years of research on the mRNA delivery platform. And the real secret sauce was that the federal government was able to de-risk the work that industry was doing. It was a collaboration between academia and industry and the federal government that allowed us to provide safe and effective vaccines within a year of the first cases being detected. And I think the moonshot approach to this is, how do we ensure that we have a robust research portfolio that looks as often as possible at families of pathogens rather than at individual pathogens? There's not enough money in the world to develop a vaccine and therapeutics and diagnostics for all 120 viruses that could infect humans. And even if you scope it down to the ones that have pandemic potential, that's still, depending on how you characterize them, 20 or so viruses plus bacteria of concern. What we really need to be moving towards is a portfolio that has a lot of that early stage clinical work done, ideally with options that are focused on families of viruses, and also on how do we better leverage the human host immune response to pathogens, so that we are building a 1-2 punch, if you will, so to respond to whatever the next big biological event might be. And that is going to take time and it's going to take money, but it's also going to take collaboration, because we're not alone in working on this. The Europeans are working on it, and obviously they've been close allies of ours for many, many years. The Japanese, the Koreans are working on this. So where we think the sweet spot is going to be, and what we continue to highlight, is we need to move from very pathogen specific, one bug, one drug approach to a more family of virus approach. And we need to do it in collaboration with allies and partners, so that we're not duplicating efforts inadvertently. If we do duplicate anything, it's deliberate, so that we have a broader portfolio. But we leverage the investments that are being made across our allies and partners to get the broadest portfolio possible. And I'd say a second part of that really ties into the moonshot approach is understanding the supply chains for all of these diagnostics and therapeutics and vaccines going forward. Because I think what we've learned, one of the many things that we observed in the pandemic was that if you're relying on a single source for APIs or for other ingredients, and that source for whatever reason is no longer available, then you're in a difficult position. And so part of the moonshot approach has to be rethinking how we have a more resilient and diversified supply chain. It does not all have to be in the United States, but it absolutely should be with those trusted allies and partners that we can count on to continue to deliver as a biological event unfolds.
Absolutely. Well, I noticed a couple months ago you were giving a talk at the 2024 Preparedness Summit. I think you're going to be at Bio coming up in a couple weeks. What else is happening for the rest of 2024 that you can tell us about? Other conferences, talks, any place that we may listen to you, run into you, and possibly meet you? Anything else that I missed? Please kindly take the floor.
Well, thanks. I'll just run through June. So in June, I'm going out to Bio, as you said, and really looking forward to meeting with many of our industry colleagues out there, especially those working in the synthetic biology space, because I think, for those who have been tracking this closely, we had the Biomanufacturing Executive Order 2 years ago. We had the CHIPS Act, we had the Artificial Intelligence Executive Order, and now the Data Security Executive Order, and all of those are linked in some pretty clear ways in the biospace, because there's such tremendous innovation that's happening right now in this space. I often will say publicly and privately, I would love to be a medical student again, because I think we are at one of those inflection points in the practice of medicine where the things we're doing today will be viewed as quite quaint and out of date 10 years from now, because of this tremendous confluence of compute and new technologies. And so, what we're eager to continue to highlight in Bio and other forums is the opportunity that these technologies are creating, and the need to partner on smartly leveraging them and building appropriate guardrails so that they're well used to continue to allow innovation, and we minimize the risk that someone might inadvertently or deliberately misuse those technologies. So really looking forward to that discussion in San Diego next week. And then the following week, I'll be at the American Medical Association. The week after that, I'm in Sydney, Australia for a series of meetings with a number of our international partners, again, talking about biopreparedness. I think there's 3 or 4 conferences back to back that I'll be speaking out there. And then in the midst of all of that, I'll just say that on the personal front, my wife and I have found our forever home, and we're moving. And so we're going to squeeze that in right after I get back from Australia. And we're working to help synchronize a number of things that are happening in real time here in the United States. Plus, we're working on input to the departments and agencies on their budget submissions on how we continue to enhance our biopreparedness here. And that's just June. So, July, a number of interesting things. And I go through all that to say how, really grateful I am for the opportunity to play a role like this. And to you and to others who are interested in learning more about it, I truly believe we are on the cusp of some revolutionary not evolutionary changes in the practice of medicine. And the opportunity is for us to embrace that and to leverage it so that the United States and its allies and partners continue to lead the world in innovation and in the work that we're doing to protect Americans and people all over the world. One of the most exciting things that's happened in the last few months that I suspect many of your listeners are familiar with is the FDA approved the first ever treatment for sickle cell anemia. And I'll end with that because OPPR had nothing to do with it, but we hold it up repeatedly because it's an example of this new wave of treatments that will become available as a result of the United States' continued investment in leading edge technologies in research and development, our recognition that there is nothing that we can't do when we collaborate and continue to invest in leveraging these technologies. We have to do it smartly, we have to do it safely, but when we do that, we save lives. And that's a pretty remarkable contribution to continue to make and to be a part of. So thanks for the opportunity for joining you today, and look forward to listening to some of your future podcasts. And thanks for holding up all the great work that people are doing around the country here.
Paul, it was great having you. I look forward to continue to follow your work. With the best regards to your team, and really appreciate everything you do to keep the United States safe, keep all of us healthy. And it was great talking with you. Great time today.
All right. Appreciate it.